Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan. Here is what I have for you today. Headache is most common pain that is suffered by many. Now, tension type headache is the most common primary headache disorder. Now, as per the Global Burden of the Disease study in 2010, tension type headache is the second most common disorder worldwide with an estimated prevalence of close to 20.8%. Trigger factors have been widely studied in the context of migraine, but very few studies have actually investigated these trigger factors in the context of this tension type headache. So, to study the prevalence of these trigger factors and the associated disorders in this particular type of headache, the researchers conducted a study including close to a total of 400 patients over the age of 15 years, who all those were fulfilling the International Classification of Headache Disorders criteria of frequent episodic tension type headache as well as the chronic tension type headache. Details regarding their demographics, their headache characteristics, the trigger factors as well as the associated symptoms were all obtained. The associated even the psychiatric disorders were also recorded. The results of the study did show that out of the 400 patients, 360, that is around 90%, were found to have triggers. The mean headache intensity on the visual analog scale was 6.7. The most common trigger factor was emotional stress among both males as well as females. There was a statistically significant difference in the frequency of the trigger factors between men and women for emotional stress, sunlight, sleep deprivation or insomnia as we all call it, noise, weather change, studying, fried food and even hypersomnia. Psychiatric comorbidity was found in 29% of the individuals, with sleep disorder being the most common factor. Tension type headache has been an underrated diagnosis despite being an extremely common disorder. The trigger factors are very less studied and their interactions are very even lesser known. So the diagnostic criteria as per the International Classification of Headache Disorders did make tension headache a diagnosis of exclusion rather than a positive diagnosis of inclusion. Therefore, the trigger factors must all be included in the diagnostic criteria, and associated psychiatric disorders should be sought for and treated simultaneously for better management as well as the quality of life. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.